Okay, welcome back, everybody. Now we are ready for the final midterm briefing for the semester, and this is on advancing emergency preparedness through the One Health Act of 2019. The advisor is Professor Louise Rosen, and Cecilia, if you are ready, let's begin.
Okay, thank you. So hello, everyone. My name is Cecilia Magos, and I will be presenting on behalf of my team on the bill Advancing Emergency Preparedness through One Health Act of 2019. Our faculty advisor is Louise Rosen, and I just want to thank my team for all the help in putting this presentation together. So let's get started. Okay. So imagine you are a worker at a concentrated animal feeding operation in North America, and one day you get a shipment of pigs from across the pond, and soon they're mixed among the pigs in your facility. You start to notice that a couple of your pigs start getting sick, so you help isolate them, and then you head home when your shift ends. That same weekend, you hang out with a couple of friends, and then one of them lets you know a few days later that they started to feel sick. If this would have been April 2009, there's a very high chance that this would have been a case of H1N1 or swine flu, the latest pandemic until recently. The CDC estimated that this single zoonotic disease outbreak resulted in 60.8 million cases and over 12,000 deaths between April 2009 and April 2010, 12 times greater than the impact due to seasonal influenza from 1976 to 2001. Zoonoses are much more common than we may believe, and currently we are unfortunately living through another zoonotic disease outbreak, COVID-19, that's reached a pandemic level that we've never seen before. And currently the US accounts for 25% of the global death rate. And given the recent spike in positive cases in the southern states, we expect that this number will rise. So this pandemic, if anything, has illustrated the need for a collaborative government response based on the One Health framework, which leads us to the bill that we will be discussing today. So on the agenda, I will be introducing our bill, give a brief overview of the One Health framework the bill will expand on, define zoonotic infections, identify some of the pathways for zoonotic spillover, highlight the impact of our proposed legislation, identify some of the key stakeholders, and then our next steps moving forward. So the Advancing Emergency Preparedness Through One Health Act of 2019 is a multi-sectoral response to public health threats that can cause major economic impact and identify potential bioterrorism. The bill was introduced to the House on July 2019 by Representative Kurt Schrader, and its goal is to advance federal efforts to prevent, prepare, and respond to zoonotic disease outbreaks using a collaborative One Health framework. It currently has 14 co-sponsors and bipartisan support as well. So the One Health framework is cited as an integrative initiative that recognizes human, animal, and environmental health as interconnected and promotes collaboration across all sectors and discipline to help solve global health problems. And this bill specifically aims to target those caused by zoonosis. I've been mentioning zoonosis and zoonotic infections, but what are they really? Zoonotic infections, are caused by pathogens transmitted from a host animal to humans through direct or indirect contact. And they account for 75% of newly emerging infectious diseases from 1940 to 2004. So many of these pathogens already exist in our natural environment. However, there are several factors that are increasing our exposure and susceptibility to these infections. In order for these pathogens to infect human and the human population, they need to cross 3 biological barriers. First is the interspecies, which is the initial exposure between an infected animal and a human. Then we have the intrahuman, which is when the pathogen is able to multiply and reproduce in the individual. And finally, the interhuman, which means the pathogen can now be transmitted among the population. The pathways to zoonotic spillover have increased due to human disruptions to the natural environment. Changes in climatic conditions have altered the geographic range and density of several host animals. For example, mosquitoes are very sensitive to changes in temperature and are known to be vector for several different zoonoses like malaria. Our warming temperatures are making mosquitoes that carry malaria able to survive and reproduce in places that were previously too cold, like in the southern states here in the US. This has caused the number of cases in the US to steadily increase since the mid-1970s. Also, our modern land use practices have severely diminished the natural barrier between humans and animals, increasing our exposure, infection, and transmissibility of zoonosis that otherwise would have been very unlikely. An example of this is very evident in Lyme disease, where urban development has altered the predator-prey dynamics between animals, resulting in an increase in likelihood of the ticks to jump to human populations due to our closer proximity to them. And our final point, the way that we interact with animals via the CAFOs that I mentioned previously, or illegal trade, and our dependence on these animals to help sustain our way of life augments our risk for future pandemics. The SARS outbreak, for example, originated from a wet market from a province in China, where wild animals come into contact that otherwise wouldn't in the natural world. Again, zoonoses are not new, but our increase in global trade, travel, and transportation are increasing our exposure. The CDC estimates that there are over 2.5 billion annual cases of zoonotic infections, resulting in 2.7 million annual global deaths. And the global cost from 6 zoonotic outbreaks between 1997 and 2009 was over $80 billion. In the US, avian influenza has led to losses of $3.3 billion in related industries and led to the cull of nearly 50 million birds, which affects our vaccine development. And it is also estimated that 80% of known potential pathogens likely to be used in bioterrorism are of zoonotic origin. So we definitely expect these numbers to rise without any proper intervention. This is why the Advancing Emergency Preparedness Through One Health Act will work to establish 10-year federal goals and priorities to promote interagency coordination and expand our partnerships, to foster scientific understanding of the interconnectedness between human, animal, and environmental health, identify, study, and surveil priority zoonotic diseases and their transmission pathways, and finally, to advance protocols and workforce development to improve our prevention, response, and recovery. This framework is already used in other countries across the world. For example, in the UK, One Health is used to monitor antibiotic resistance in their livestock to reduce the risk of an outbreak among their civilian population. So this is something that can be adopted to our government as well. I do want to acknowledge that One Health is not completely new to us. Our current framework does include a couple of agencies such as the CDC and the Department of Agriculture. However, this bill hopes to expand and invite additional stakeholders from relevant agencies. And the collaborating parties will be monitored by the Secretary of Health and Human Services, Alex Azar, and the Secretary of Agriculture, Sonny Perdue. The new collaborative effort will include the U.S. Agency for International Development that can provide training and support to the next generation workforce, the Environmental Protection Agency to help develop environmentally sustainable responses and strategies, the Department of Homeland Security and the Department of Defense, to work against potential bioterrorism threats, and the Department of the Interior and the Department of Commerce to help understand linkages between environmental conditions and health outcomes. So together, they will all align their efforts with the CDC, the Food and Drug Administration, the Office of the Assistant Secretary for Preparedness and Response, and other departments and agencies and partners as appropriate, including states, Indian tribes, academic institutions, non-governmental organizations, and other private entities. So this is a very comprehensive bill. So in our next steps, we will be including an analysis of the proposed collaborative plan, as well as identifying some of the challenges and other potential impacts of the legislation. To conclude, We know that zoonotic infections have been increasing throughout the years, and consequently, government intervention, such as the proposed Advancing Emergency Preparedness through One Health, is necessary for clear guidance, not only to respond to these outbreaks, but to have proper preparation and prevention plans under a collaborative One Health approach. And just one final note, the current pandemic has only emphasized the need for a prepared response. As of last night, the number of deaths in the US have increased to 121,176, and that's over 3,000 more from the number that is on this slide, which was taken just shy of a week ago. So there's a dire need for a plan of action like emergency preparedness through One Health with a clear focus and leadership, not only to protect our economy and the capacity of our infrastructure, but also most importantly, the lives of the people this government is also supposed to serve. Thank you, and I will now take any questions.
Okay, very nice job. Thank you, Cecilia. Stephanie, do we have some questions?
See, not yet. Oh, all right, Charlie has a question.
Hi, Cecilia. I was just wondering if you knew about the U.S. Agency for International Development's program called PREDICT that was taking place under the Bush and Obama administrations and was discontinued under the Trump administration, that was responsible for tracking zoonotic diseases. How does this proposed bill sort of build off of the work that that program had been doing, or perhaps differ?
That's a great question. Our current research, we haven't really found or really dived into that program, but the proposed plan hopes to, we're not trying to reinvent the wheel. One Health is already being implemented in the US, just not as with such an expansive network. And it's also being implemented across different countries around the world. So what this bill just kind of aims to do is to just help us better prepare and respond to these outbreaks. And with that, with the program that you mentioned, we haven't really dived into that, but I think that is something that we will be looking into as we dissect a little bit more of the proposed legislation.
Great, we have a question from Rachel.
Hi, Cecilia. My question is about the prevalence and severity of zoonotic diseases. I think you mentioned something like 2 billion infections per year, which is like orders of magnitude larger than even the confirmed pandemic cases. So are a lot of these infections like minor, that is why we're not hearing about them? Or could you explain a little more about how there are so many?
Right, so a lot of the outbreaks that we identify, 75% of them are of zoonotic origin. So they're very, very common. And the number may seem very big because it can be something like salmonella, it could be like malaria, it could be Ebola. So they're a very, very large number. But again, we do expect this number to keep increasing because our human disruptions to the natural environment has left us more exposed to these zoonotic infections. So that's why we need a prepared response to them.
Thanks.
We have a final question.
Last call for questions. All right, I think that's it.
Okay, well, thank you again. Thank you, everybody. Let me just mention what we've just accomplished. First, in about an hour and 20 minutes, we have gone through 5 major pieces of environmental legislation. We've summarized these pieces of legislation and the nature of the problem they're addressing succinctly and with really great communication, great graphics, carefully thought through. Everybody's worked very hard to hone these messages. And the reason why this is such a valuable exercise, frankly, is this is what you're going to be doing for your entire career. And I want you to think about how much you knew about these problems and these programs the day after Memorial Day or 2 days after Memorial Day when you arrived in the workshop, and how much more you know now. And what this really demonstrates is the educational impact of learning by doing. When you're actually engaged in trying to really figure out, what does this bill say? What's the nature of this problem? You really learn a lot more than just by sitting around and, just doing a normal assignment. And you know a lot about these. When by the end of next semester, these groups will know more about this legislation and the problems than pretty much anybody else in the country, if not the world. And so I want you to think about how the learning process takes place, and also how we've shared with each other our knowledge of these bills. Those of us who are not immersed in the bill, from other groups, we sit and we get a 10-minute briefing, which really does get us up to speed in a really amazing way on what we've learned so far. So what's going to happen next is we're going to focus, we've now focused on the problem and the way the bill's structured. Now we're going to get into the solution. How do we solve this problem, and what's the science behind the solution? And we'll also talk about other things like performance metrics. So in celebration of July 4th, we're going to be taking next week off from workshop. I understand you have some other work you need to be doing in some of these science courses and so on. But we're going to take the week off from workshop, and then we'll return the following week. Professor Apps and I will talk a little bit about performance measurement, and we'll start getting into the science of the solution itself. So again, a wonderful job, everybody.